Just a quick recap about Jeff. Single follicular unit excision procedure in the range of about 1,800 follicles. He's had tremendous success. The growth has been solid. He's been able to maintain his existing hair. He's now probably 3 years out from his transplant. It was great to see him back today for a revisit.
My hair loss started when I was about 20. I used to style my hair in a very particular way, and I noticed I was changing that style to make it concealed. So that's when I first noticed. I learned about medical therapy from Dr. Boden. He taught me about Rogaine, finasteride. Those were the two things I started. Oral finasteride and 15% minoxidil lotion. I started those before I considered any sort of hair transplant. I was on those for about 6 months or so. So I decided to do a hair transplant because I knew if I was not going to get any fix in the front from the medicine, I probably wouldn't be happy. I wanted to style my hair up and I didn't want to worry about it. Spend so much time in the mirror every day, nervous about going out, seeing friends, just feeling insecure. So I figured, yeah, let's do it. Dr. Boden suggested not to make my hairline drastically low because long term it's going to look unnatural. He said, let's thicken it up. Let's lower it by a few centimeters in the corners. That way I can still style it up.
We took a lot of time drawing in a hairline. We looked at the photos, we took pictures, but what I am always aiming to create is a natural appearance that frames the eyes. And we talked about this. We spent, what, a half an hour drawing in a proper hairline that is going to stand the test of time when you get you through your 20s into your 50s into your 80s, and will always look natural. And some people will say, well, isn't that a little receded? But my perspective is it has to look like a natural recession so that it will look natural over your lifetime. We're not trying to create a straight hairline because that doesn't look natural. So really what we're trying to do here is create an appearance of natural elongation. We're not trying to create a flat hairline. And if you turn, we're bringing the hairline down about a centimeter or two, but we're really strengthening, 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 strengthening throughout. That's what we're aiming to accomplish, bringing this hairline down to provide proper balance and to look natural over the course of your lifetime.
The day of the surgery, I was definitely nervous because I had no idea what to expect. As far as pain level goes, I didn't know what to expect. The day was smooth. The only uncomfortable part for me was the numbing of the scalp. After the numbing was done, didn't feel a single thing. The team in the back was very supportive and caring. Even through the numbing, they were, rubbing my shoulder, like checking in with me. Dr. Boden's easy to talk to. He does not make you feel nervous. So I felt like I was in a very comfortable environment. Yeah, it went very smoothly. Post-op, the night of, Uzi wasn't bleeding, but just felt like a little wet back there. Changed the bandage that night. They told me not to wear it at night. Took that off. Once it got some air, it healed up so fast. I'm telling you, like the next day, I didn't take any pain medicine, nothing. I didn't need anything. It just kind of felt like a sunburn sensation. I washed my hair that next day, cleaned everything up once, all the dried stuff was out of there. They checked in on me, day to day. They would call me, see how I was feeling. Discomfort levels stayed very low. I just followed the instructions. I washed my hair, didn't do exercise, and I was totally fine. Came in for my follow-up 14 days later. They took a look. Everything looked great. It healed really, really quick. And once my hair started growing a little bit over the back, all the redness was completely covered. The first thing I noticed after the healing process was done was my hairs actually fell out. The transplanted hairs, I saw tiny little hairs shed, and I was like, oh geez, is that all right? Is that good? But it is okay. I've learned it was fine. That's normal. And then after those hairs shed, I looked back to the way I did before the transplant for about 4 months. At the 4 month mark, it was almost like a little shadow that I started to see. And then gradually from 4 months to 12 months is when I saw it come in. So it's not like I woke up each morning and said, oh my God, huge change. It was just very gradual for a year, year and a half. I went to a wedding where there was a bunch of high school friends and we haven't seen each other in about 3 or 4 years. And someone came up to me and they said, wow, your hair looks really thick. How do you style your hair? What do you use? And I told them, I said, actually, I had a transplant, and they were surprised. They're like, what? They couldn't believe it. Um, and that was a fun moment. So I'm kind of open about it. Like if someone asks me about my hair or says, wow, your hair looks great, I'll just tell them I had a transplant. It works. And the volume of my hair is much greater than what it was. Like it is full and thick. I still have recession, but it's not as high as it was, and it still looks like my own hair. The last thing I'd want is a hair transplant that I regret like 10 years later.